Hi, my name is Calen, and I am going to be your student nurse today. What is your name and date of birth?
Brooke Houghton, 04/28/1998.
All right, great. I'm going to put on my hand hygiene. I'm also going to provide some privacy. Do you feel safe in this environment?
I do.
Okay, great. Brooke, what is your what is your name?
Brooke.
And where are you?
The school
Why are you here?
for a checkup.
Great. And what is our president?
Dr.
Who was our
Jones.
president? Great. All right, you are alert and oriented, times 4. And are you in any pain today?
No.
Okay, great. So 0 to 10 on the pain scale.
0.
Now, and you feel comfortable, as you said.
Yeah.
Feel very safe. And what have you had for breakfast?
I've had a burrito.
Okay, what did you have for dinner and lunch yesterday?
For dinner, what did I eat for dinner? Carne asadas, and then yesterday for lunch I had a turkey pot pie.
All right, so you seem well nourished. And your posture is erect. Your speech is articulate and appropriate to the situation. I don't see any physical deformities based on looking at you. Your facial expressions and affect are calm and cooperative, and you seem to take pretty good care of yourself. You don't have any body odors, and I don't see any other aspects of abnormal hygiene. Okay, we're going to go ahead and inspect your skin. It appears pink and moist, dry and moisturized. You can tell you're using a moisturizer. Your turgor, which indicates hydration. You have no tinting, which is great. Again, you don't have any lesions that I can see just by looking at you. Great. And let's look at your hands. Oh, computer. All right. Okay. So I don't see any evidence of clubbing. And when I press on her nail bed, she has a capillary refill of less than 3 seconds. All right, so now we're going to go ahead and inspect your eyes. I'm first going to look at the anatomy of your eyes. Your sclera is white. Your pupils are about the size 3. Oops, sorry about that white. And your conjunctiva is pink and your eyes are moist. There's no dryness. But is there any pain in your eyes right now?
No.
Okay, great. So we're going to do a couple of eye tests. First, I'm going to have you cover your right eye. I'm also going to cover that eye. And we're going to check your peripheral vision. Tell me when you see it.
I see it. I see it. I see it.
Cover your other eye. And tell me when you see it.
I see it. I see it. I see it.
Keep that eye covered, actually. And we're going to do this way.
I see it. I see it. I see it.
And awesome.
I see it. I see it. I see it.
Okay, you saw it at the same time I did, so that means your peripheral vision is in check. Next, we're going to do the 6 cardinal gaze, and this is going to check and make sure your eyes are good. Okay, look at my finger. And just follow. All right, perfect. Gaze is great. Now I'm going to shine the light in your pupils to make sure it shines symmetrically on both pupils, and then I'm going to come over here. And I'm checking for accommodation and pupil constriction. All right. I've noticed perla with both of your pupils, and you had appropriate corneal reflex. And now we are going to move on to your ears. Is there any tenderness?
No. Nope.
I also did not notice any redness, lesions, or masses, so that is good. Now we are going to do a whisper test to make sure you can hear.
Okay. The black dog. The white dog.
All right, great. You can repeat what I said. And so you have bilateral hearing in both ears. Now we are going to go ahead and check your facial features. So first, I'm going to inspect the skin. As we said earlier, it's moisturized, appropriate color for ethnicity. Let's go ahead and check your temporomandibular joint. Open your mouth. Perfect. It's palpable. Tell me if you sense any pain in your frontal maxillary sinus. No? What about here?
No.
No pain in frontal sinus either. Now we're gonna check for facial nerve, cranial nerve 7. Can you smile? Raise your eyebrows and smile. Scrunch your face. Can you blow your cheeks out? Great. All nerves seem to be intact. Now I have noticed that your head is symmetrical to the body. I'm also going to check your scalp. Can you lean forward for me? Just checking for any dandruff or any lesions, masses, the huge. All right, great. There is no infestation of lice and no dandruff, and your scalp appears to be healthy along with the symmetrical cranium on both sides. And now we are going to test the sensation. Okay, tell me soft. Okay, close your eyes, and I'm going to test a certain part of your face, and tell me if it's sharp or soft and where it is.
Soft, my right cheek. Soft, my left cheek. Hard, my right cheek. Sharp, my chin. Soft, my forehead. Sharp, my right forehead.
All right, good, good. Okay, we're good. And now we're gonna palpate your TMJ one more time. Perfect. All right, your face is great. Before we move on, I'm gonna check your accessory muscles. Please raise your shoulders. Yes. And then can you put resistance to my hand? Resistance to my hand. Okay. Awesome. We're going to check for your lymph nodes, just to check to make sure there's no swelling or anything. All right, any tenderness?
No.
Any in your preauricular?
No.
Or actually preauricular. All right, postauricular?
Yeah.
Great. And then what about your occipital?
No.
Any tenderness? Okay, great. Your lips don't appear to be cracked, and they appear to be well moisturized. I'm going to use my pen light. Please open your mouth. All right, you have a great midline uvula. Don't need to check that. Your buccal mucosa seems to be good. You have pink cheeks and a moisturized tongue. Now I'm going to check your carotid artery. All right, we got about a 2+ pulse on that. What about this side? Also a 2+ pulse, equal pulse on both sides. Now I'm going to check for a range of motion on your head. You can move your head up, down, right, left. Awesome. Okay. Now, we're going to check your upper extremities. First, let's examine the skin to make sure there's no lesions. No. Your skin appears well moisturized and dry. And skin's appropriate to ethnicity. Okay. So we're going to check your strength. Can you grab onto my hands? Yes, symmetrical strength. And push against my hands. Now, pull. Nice. Great. Let's move to your chest. Actually, I'm going to move you back because I rather do back. Okay. Okay, we're still recording. Okay, so to start, I'm going to inspect. All right. You don't have any visible lesions and the skin tone is even. I'm going to palpate. Tell me if there's any tenderness. No. No? Okay, I'm going to check your spinous process to make sure there's no protruding vertebrae. No pain?
No.
Great. Okay, it's even on both sides. Take a deep breath for me. Okay, good. You have bilateral symmetrical expansion. Okay, well, let's listen to some breath sounds, shall we?
Okay.
Okay. Just take a deep breath for me when I do my thing. When I do my thing. Here we go. All right. And breathe. Okay, I didn't hear any crackles or wheezing, so that's good. You had really clear breath sounds. Now I'm going to find that costovertebral angle and percuss. All right. Nice and dull, just the way we want it. Okay, now we're going to the front. So, you can leave your shirt on, but nope, your skin seems clear, no lesions or evident masses. Skin is even. We are now going to listen to the breath sounds on the front of your chest. Take a breath. All right, great. Now we are going to look at your heart. Before we start, I'm going to feel for your apical pulse. All right, great. And now I'm going to have you lean forward. I'm going to listen to it. Great. The apical pulse at your fifth intercostal is nice and strong. All right, can you please lay on your left side? I'm just going to make sure there is no galloping. No galloping was sensed. You can please stand up. Okay, now I'm going to listen to the 5 points of your pulse, starting with my diaphragm. Very strong pulse. It's about a 2+ on all 5 points. Okay, great. Now we are going to move to your abdomen. Can I have you lay down for me? Mm-hmm. Great. And you're still feeling comfortable, right?
Yes.
Great. Okay, I'm just lift your shirt real quick. Under inspection, skin is even on both sides and no evident lesions or masses to my eye. Okay, I'm going to listen and auscultate for some bowel sounds. I'm going to start in your right lower quadrant because we're always going to hear bowel sounds right there. Okay, and then I'm going to switch to my bells, to your aorta for bruise. Right, and no bruise detected in your aorta. Now I am going to lightly palpate. Let me know if there's any tenderness. Great. Okay, now we're going to palpate a little deeper, just so I can make sure there's no masses. Any evidence of that on your organs? No tenderness? All right, great. And right before you stand up, we're going to check for a tympani. All right, great. Tympanic all throughout. Now finally, we are going to check your lower extremities. Mind if I just pull up your stockings? All right. Your hair distribution is also even. And skin color is even throughout. Okay, now we're going to check for strength. Can you pull against my resistance? Great. You have bilateral strength on both, of 4 on both sides. Okay, now press against my hands. Great. Nice. Now push against my hands. Yes. Okay. Now we're going to check your posterior tibial pulse. Okay, great. Okay, also great. We're going to take your shoe off, and we're going to assess for this. Pedal dorsalis. Another shoe off. All right, pedal dorsalis detected. Let's say equal strength. And pulses. Okay. Based on your inspection and palpitation, I'm not feeling any pitting edema You're out of here.
Thank
I'll
you.
let the doctor know you're here.